This instructional video will assist with the administration of your IV syringe push method administration. Always remember to keep your PICC line dry and intact. And if it starts coming loose, let your home health nurse know so they can change the dressing. To start, make sure you have a clean work area and clean your hands thoroughly with antibacterial soap and warm water, and then dry your hands with a clean towel. Make sure to remove your medication from refrigerator 30 minutes to 1 hour prior to use to ensure your medication is at room temperature. Never speed the warming process by heating the medication. The next step is to gather your supplies and medication and prepare for the infusion. Make sure you have the following supplies ready: your IV flush picture guide, medication bag, flush syringes of saline, alcohol wipes, and a trash container. Then you will inspect the medication syringe. Make sure you verify the correct name of patient, the medication, and review the discard date of medication. The medication syringe should be free of cracks or leaks. Call the pharmacy if there are problems with the medication bag or incorrect label information. The next step is to flush your IV line with saline. If applicable, release the clamp on your IV catheter and/or extension. First, scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry for an additional 15 seconds, and refrain from blowing on it. Remove the protective cap from the saline flush syringe. Do not touch the syringe tip after removing the cap. Push out air and few drops of excess solution by holding syringe with the tip facing the ceiling and pushing the plunger up. Attach the saline flush syringe to the needleless connector on your IV catheter using a push and clockwise twisting motion until secured together. Flush your IV catheter using a push-pause method. Remove and discard the saline flush syringe in a trash container. If resistance is met when trying to flush, verify clamp is open. If resistance is still met, call your nurse. The next step is to administer your medication. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow it to air dry. Then, remove the protective cap from the medication syringe. Next, attach the medication syringe firmly to the needleless connector on your IV catheter using a push and clockwise twisting motion until secured together. Slowly begin to push the medication syringe using the pulse method over a 3 to 5 minute period. When the medication syringe is completely dispensed, disconnect from IV catheter. Discard medication syringe in a trash container. The next step is to flush your IV line with saline again. First, scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry for an additional 15 seconds, and refrain from blowing on it. Remove the protective cap from the saline flush syringe. Do not touch the syringe tip after removing the cap. Push out air and few drops of excess solution by holding syringe with the tip facing the ceiling and pushing the plunger up. Attach the saline flush syringe to the needleless connector on your IV catheter using a push and clockwise twisting motion until secured together. Flush your IV catheter using a push-pause method. Remove and discard the saline flush syringe in a trash container. For your last step, you will flush your line with heparin. First, scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry for an additional 15 seconds, and refrain from blowing on it. Remove the protective cap from the heparin flush syringe. Do not touch the syringe tip after removing the cap. Push out air and few drops of excess solution by holding syringe with the tip facing the ceiling and pushing the plunger up. Attach the heparin flush syringe to the needleless connector on your IV catheter using a push and clockwise twisting motion until secured together. Flush your IV catheter using a push-pause method. Remove and discard the heparin flush syringe in a trash container. If you have 2 ports on your IV catheter, make sure you flush each port at least once daily. Option 1. If you have multiple doses of medication per day, you can use one port for your first dose and use the other port for later doses. Option 2. Complete SH portion of SASH procedure on an unused IV catheter port by flushing with saline and then heparin as indicated above. If you plan to infuse 2 medications back to back, make sure you flush in between each medication with saline and end your infusion with a heparin flush. Use SASH procedure as indicated above by flushing line with saline, administering medication number 1, flushing line with saline, administering medication number 2, flushing line with saline, and then flushing line with heparin. If your medication is ertapenem, you will need to draw up the medication from the vial into your syringe and use flush method as noted previously for medication administration. Finally, call Landmark Infusion at 866-388-3883 if you have any questions or problems, or if there is redness, swelling, or tenderness at your IV site. Remember, our pharmacists are here for you 24/7.